Good afternoon, friends. I am Dr. Prashant Jagtap, interventional cardiologist from Wockhardt Heart Hospital, Nagpur. Today I am going to brief you about the rising incidence of heart attacks, particularly in the young people. You'll be amazed to know that in Indian circumstances, we have very young population who suffers from heart attacks. In fact, the average age of an Indian who suffers a heart attack is 52 years, as against 62 in Western population. So this is truly disturbing because India is a young country and we cannot afford to have young people dying of heart attacks. And mind you, when a heart attack strikes, it is the first 30 minutes which is most important because it is during this period most of the deaths occur. Now, what is the solution and what can be done? Well, the greatest problem of our country is heart attacks today. But the simplest solution for this greatest problem is just modifying your lifestyle. I would give you a formula of 5S. Stay away from this 5S and I think the country would be much more healthy than what it is today. The 5S stand for 1. S is smoking. Second is sedentary lifestyle. 3, salt. 4, sugar. And 5th, saturated fats. All, if you can stay away from this 5S, and I am particularly concerned about smoking in the younger generation. Smoking almost creates a situation when a clot forms in one of your arteries of the heart and kills a patient. Apart from that, sedentary lifestyle, lack of exercise, consumption of salt, sugar and saturated fats. This triple deadly combination creates a havoc. In fact, in our hospital setting in last 10 years, we have found that about 15 to 18% patients have heart attacks in a younger age group. So that is a very high incidence. So, younger people, 15 to 18% in general population suffering heart attacks, very high incidence. And probably I would say, the younger generation needs counseling. The younger generation needs direction. The younger generation probably is not aware that it is the wrong lifestyle which is putting them into trouble. To give you certain statistics, in India, about 5 lakhs angioplasties are done in a year. And the number is growing by almost 20 to 30% a year. So day by day, the angioplasties are rising, and the angioplasties are rising because the heart attacks are rising. And you might be aware, India is the diabetes capital of the world. So in a hospital, if you look around, about 30 to 40% patients typically in a heart hospital are diabetics. This high incidence of diabetes in Indian population is also creating a havoc. And the solution for diabetes and heart attacks are more or less the same 5S formula I have told earlier. Well, you might be aware about angiography, you might have heard about angioplasties, you might have heard about bypass surgery. But this is a treatment after you suffer a heart attack. The real key lies in preventing heart attacks. That is very important. And prevention, as it is said, prevention is better than cure. Let us take an oath that everybody starts exercising from tomorrow, we help each other, we call each other in the morning to do a joint exercise program so that everybody is stimulated, everybody is excited to do an exercise program. In one of the studies done in Bangalore, people are aware that exercise helps. People know that exercise keeps you away from diabetes. But the real problem with the patients is lack of motivation. And motivation has to come within. So we all have to strive hard, particularly the younger generation. We have to work hard. We have to get up early in the morning for a walk, for swimming, for cycling, or maybe in the evening whenever time permits. And you have to do about 20 minutes of exercise 5 times a week. That is enough. So, generally people have a misconception that they should do daily exercise. It's not like so. You have to do just 20 minutes 5 times a week, and that is good enough to keep the heart healthy. Another point I would like to stress is the fast food scenario, which has lots of salt, lots of fats, particularly the saturated fats, and of course sugar, which is so commonly seen in carbonated drinks. I think you should eat them, but that should be in moderation. That is the key. Moderation is the key. I am not telling you not to eat those things, but you have to keep things into moderation. And coupled with that, if exercise program is regularly followed, it would be a great effort towards making our nation a healthy nation. And already the media, the newspapers, the television, the print media is making efforts to make people aware about this malignant heart disease, particularly in young Indians. It is very disturbing to a cardiologist when he sees a young 35-year-old person with not one but 3 or 4 blocks, and often, more often than not, it is the wrong lifestyle which has brought him into trouble. Coming to the treatment part, we have different modalities of treatment, which includes giving medicines to the patient. The medicines typically for a heart patient involves a tablet which is called as aspirin, which prevents clotting. There is another tablet which might be for blood pressure, for diabetes. The third one is for lowering the cholesterol. Now, all these tablets for those patients who are suffering from heart problem, maybe he has undergone angioplasty, he has undergone bypass surgery, or he has suffered a heart attack, these tablets should be taken lifelong. In practice, I often find that patients stop the tablets, and that creates a problem. Another important point which I would like to highlight is whenever anybody has a pressure-like symptom on the chest, or he has pain in the chest, or something like acidity which lasts too long, which is typically on the chest and spreads to the left shoulder, left arm, or to the left mandible or jaw or back, one should be alarmed and typically consult a family physician and get an ECG done. Often patients present late to a doctor, and the precious chance of treating a patient in the golden hour is lost. And the golden hour is typically 1 or 2 hours after a heart attack. And don't forget or keep in mind that during the nights also, all hospitals are open, and you must go in the night if you have any suspicious symptoms to a nearby hospital. Call an ambulance, take help of ambulance, go to the casualty department, get a ECG done, and rule out a heart attack. It's very, very important. It is painful to see for a cardiologist, for somebody who has suffered a heart attack and he is reporting the next day morning the golden time to treat the patient is gone, resulting in permanent damage to the heart. And this damage is permanent. Patients cannot recover from that. And it not only kills working hours of that family, many times the person whose heart has become weak is the only breadwinner for the family. So, quickly realizing that these are the symptoms of the heart attack, anything suspicious, particularly if in your family you have family history of heart disease, you have diabetes, you are a smoker, your cholesterol is high, you should be more alarmed. And somebody wants to test, he can do a simple treadmill test with a physician and get a fair idea about the pumping or the heart's ability to work in stressful conditions. There are other ways also to know about the heart's condition. One of them is an angiography, which is done with the help of a CT scan, which is an outdoor procedure, outpatient procedure, and one can know without getting admitted if there are blocks. But this is typically reserved for a person who has a very strong family history of heart disease, who has symptoms which are atypical, which the cardiologist thinks that probably they may be of heart disease, or patient has diabetes, or his stress test or TMT test is positive. In such circumstances, we do a CT angiogram. Many times, patients ask me, or a question is asked, what is an echocardiogram? An echocardiogram is nothing but a sonography, which tells about the structure of the heart and also the function of the heart. In the heart, there are 4 valves, how the valves are functioning, how the heart is pumping, whether there is fluid around the heart. Many more things can be known from the echo. Just like you do sonography, the sonography of the heart is called as echocardiography. ECG you already know, but no doctor in the world can tell about a heart attack without doing a simple ECG. ECG was invented long back, more than 100 years back, but even today, there is no replacement for an ECG. So, whenever a doctor tells you to do an ECG, please do an ECG and get it done. Because ECG is very important. It can tell not only about the heart attack, but it can precisely tell where is the heart attack, how big or how massive is the heart attack. And that is the beauty of the ECG. Contrary to other big machines in medical science, ECG can be taken to the bedside, or it can be taken home, and ECG can be done at home, ECG can be done into an ambulance, and the moment the paramedic finds that the ECG is abnormal, he quickly reports the hospital, the doctor, the staff, so that emergency measures can be taken and the doctors can arrive at the spot much before the patient arrives. And this is very important. Every minute counts. And in fact, it is said in cardiology language that every minute is muscle. The faster a patient gets a treatment, the more muscle he saves. And treatment, apart from angioplasty, is giving a clot buster injection, which can be given anywhere. In fact, it can be given in ambulance, it can be given in one of the remotest villages, it can be given in primary health centers. But the biggest problem is you should know that it is a heart attack, and the heart attack is diagnosed by ECG. So you have to have a place where you can do an ECG. So these are the certain tips about heart diseases to repeat and to make you aware. It's very important to report your symptoms to your family doctor. Stay away from 5S, sugar, saturated fats, smoking, sedentary lifestyle. Very, very important. All these are the final points which will make our nation a healthy one. And if I'm not right, younger people, our demographics is such that India is a young country, and we don't want the WHO projections about heart disease in India to come true in next 15 years. If we start exercising, working well, doing our job, taking time out for relaxation, pursuing our hobbies, it will go a long way in making the country as well as our family healthy and happy. I have a few questions, and the first question is, what are the symptoms of heart attack? I think it's worth repeating once again. If you have a pressure-like symptom on the heart, something as if you have put a heavy object on the chest, the pain typically radiates towards the jaw, towards the back, and towards the left arm, and very rarely to the right arm. If you have some symptoms, which can come at any time, maybe at rest, when you are sleeping, when you are walking, when you are taking bath, these are very alarming symptoms. And with age, not a criteria. Even if you are 32-year-old, if this pain is lingering, you are getting some sweating, you are a little bit having cold sweat, immediately report to a doctor. Very, very important. And that is the first missing link in our country. Patients don't report to the doctors. They come very late. The average reporting time in India, as per a study, is 300 minutes. That is 5 hours after the chest pain starts. And that is a bad scenario. That's a very, very bad scenario. If you report after 5 years, then the whole charm of treatment is gone. I have another question. Should we run or walk more? Which is better? Well, it doesn't matter whether you walk briskly, whether you run, whether you do cycling, whether you do swimming, whether you play badminton. Any game, or for that matter, a brisk walk, about 20 to 25 minutes a day, 5 times a week is good enough. How to leave smoking? That's a very important question. I think if you want to leave smoking, the first thing you need is determination to leave smoking. And if you have the determination to leave smoking, then only go to a doctor. He will help you out. There are lots of techniques which is beyond the scope of today's chat. But first and foremost is the determination of the individual, which is most important. Now, one question is, what are the investigations to be done to know your heart is okay? Well, I say know your numbers, check your numbers, know your cholesterol, know your blood pressure, know your waist-hip ratio, know your blood sugar, and know your blood pressure. If you know these 5 numbers, good enough. Next is ECG, and probably if you are more than 35 years of age, you can do a treadmill test and get a fair idea about your heart, meaning how the heart is pumping, whether it's pumping well. And you're typically asked to walk on a stress test machine, and simultaneously ECG is being done. The ECG changes probably hints the cardiologist there's something wrong in a patient. Mind you, a stress test is a sort of crude test, but it is simple to perform. That is why it is done so routinely. You can't do an angiography in each and every patient. So it is a good screening test. And I have told you as earlier, another test is the CT coronary angiography, which is also an outpatient procedure, but it should be done as per advice of physician. And one should not do a coronary angiogram by CT just as a routine investigation. One of the questions asked is angioplasty, whether the effects are long-lasting. Well, angioplasty is a wonderful method. In fact, it's the most common operation done today in medical science, and with great advances. As I told you, 5 lakh patients got benefited last year with angioplasty, and probably this is only 1/10 of a number. 9/10 of the patients do not get angioplasty because of financial reasons. One of the questions is some ECG changes, whether it is a right bundle branch block. Well, it is a common finding, a right bundle branch block. In about 3 to 5% of individuals, you get a right bundle branch block in the ECG. It is a pattern, and there is nothing to be worried. And just consultation of a cardiologist is enough. Another question which is being asked often is, what are the precautions I should take after bypass surgery? Well, if you do, or your relative has undergone a bypass surgery, it is very important that the first month you take rest, you take all the precautions, take care of the wound. It should not get infected, and you should be more careful if you are diabetic. That's very important. Infection should not occur in the wound. And the physiotherapist and the dietitian would help you regarding the diet and the exercise program. By about 6 weeks, you should be able to, or the patient should be able to start work, or 6 to 8 weeks. He should not, lift heavy objects, or should not drive for first 3 months. One of the questions I am often asked in public lectures is, how is the angiography done? Well, angiography is a very elegant and simple technique, which is either done through the wrist or through the groin. The heart sends blood to the body through blood vessels. Now these blood vessels go through the hand, through the legs, and well, this provides a platform to the cardiologist to reach to the heart. And mind you, it's done under local anesthesia when the patient is fully conscious. Just by giving local anesthesia, just like you go to a dentist, he gives you local anesthesia and does dental surgery. Similarly, angiography is done through the wrist or through the groin by giving local anesthesia. A small tube is passed, it reaches right at the base of the heart. A special contrast is injected into the arteries, and with a sophisticated X-ray equipment, pictures of the arteries of the heart, which are typically 2, right and left, are taken and blocks are highlighted. Now this angiography takes about 10 minutes. If the angiography is done through the wrist or the hand, patient can go home by 4 hours. If it is done through the groin, he has to stay in the hospital for at least 12 hours. Now this is about angiography. I've told you about angioplasty. In angioplasty, another question which is used is, what are the types of stents? Well, the history of angioplasty is such that first balloons came and angioplasty was done only with the help of balloon. But the artery collapsed and hence stents came into picture. Initially, there were bare metal stents which would act as a pillar, scaffold to keep the artery patent and open. But soon it was realized that these bare metal stents get choked in about 20% of the patients. So drug-eluting stents came, and the drug-eluting stents elute medicines from the stent. These stents typically don't get choked, the incidence being about 4 to 5%, and these stents are very good. Now we have second generation and third generation stents. We also have absorbable scaffolds. We have newer designs. If you put that scaffold in the artery over a period of 2 years, that scaffold would dissolve and disappear. One of the questions is, what is the turnaround time for treatment of a patient to when she get an attack? Well, as I said, every minute is important. You reach the hospital. Our target is door to balloon or door to angioplasty time less than 90 minutes. meaning you reach the hospital and I have to carry out the angioplasty within 90 minutes. That is my target. But as I told you, you have to reach the hospital fast. Can anxiety or stress trigger heart attack? Well, this is a very interesting question. Certainly yes. Anger, 2% of the heart attacks preceded by anger. Stress and anxiety, yes. I'll give you an example. In US, there were 2 earthquakes. And as you know, when an earthquake occurs, there is a lot of anxiety amongst people because of human loss, because of property loss. And it was found out statistically that in both the earthquakes, post-earthquake 1 month, the incidence of heart attack increased. Anxiety, stress is definitely a risk factor. But all types of anxiety may not lead to a heart attack. Another interesting finding was post-terrorist attack in US, the incidence of heart attack after that did not rise. So anything which bothers a person, which may be a job stress may be, person may not be happy in a particular job. He probably might be thinking that he is not getting worth his due, and that is also job stress. So these are the various types of stress. Then one of the commonest stress females suffer is at home, that is called as stress of caregiving. If there is somebody who is sick for long in a household, then the lady has to work for long hours nursing the patient, and this gives a different type of stress. People have stress during examinations. People can have stress because of multiple domestic reasons. But one of the most common stress which has given rise to heart attack is job stress, which is related to environment of that particular individual. Another important thing, almost in relation with anxiety and stress, is depression. If a person is suffering from depression, he has a higher chance of getting a heart attack. So depression is dangerous, and depressed people are socially isolated. They keep themselves away. They do not take medicines properly. They do not follow guidelines from the doctors, and it is universally proven that in depressed people, the incidence of heart attack is higher as compared to other individuals. One of the important points I would repeatedly like to stress is, despite lots of ambulances in all the major cities, the general population is not making use of the ambulance service. Often they call the doctor and first they would request whether you can come home. Well, that is not a treatment. And now we have many other questions. Is yoga good for managing stress? I think one of the best ways to manage stress is yoga and meditation. 30-minute yoga goes a long way in keeping you healthy. Very, very important point. And this such simple techniques of yoga, meditation, exercise should be incorporated in the lifestyle. So cycling once a year or walking once a year is not exercise. It has to be repetitive. Then only it can be of great help to the heart. Well, exercise, apart from helping the heart, it also reduces your blood pressure. It makes you more positive. It controls your diabetes. So there are many more benefits of exercise. Are women more prone to heart attack as compared to men? No. I would say men are more prone for heart attacks. Women are typically, have the protective cover of the hormones till they attain menopause, till 45, 50 years of age. After 50 years, probably the incidence of heart attacks in men and women is almost same. In fact, when a woman suffers a heart attack, the consequences are much more disastrous than when a heart attack occurs in men. So, and also the mortality is high in women. It is more difficult to treat heart attacks because of the various complications. It is very important. But that doesn't mean that women should ignore symptoms of heart attack. Even if a young woman gets symptoms suggestive of heart attack, she should report to a doctor and get an ECG done. How much should I exercise for a healthy heart? Again, to repeat, 20 to 25 minutes a day, 5 times a week, that is enough. This is enough for the heart. One more question. Can a healthy person get a heart attack? Well, till you suffer a heart attack, you are otherwise healthy. And this is the commonest statement we hear when a heart attack patient comes to a hospital. Doctor साहब ये तो अभी तक हमारे साथ बात कर रहा था. Means he was healthy in the office. Well, that is typically a heart attack strikes. It strikes suddenly and it kills suddenly. So these things happen very fast with no danger signals at all. So healthy people only suffer heart attack and then only they become heart patients. So it's very, very important to know that you have to, even if you are apparently healthy, you have to get yourself investigated thoroughly and keep repeating those investigations every 2 or 3 years, keeping in touch of your family physician. That's very, very important. So I close this chat. I was very excited to answer all the questions. I sincerely hope that it has helped you. Once again repeating the fact that it is the healthy lifestyle which will make our country healthy. It is the healthy lifestyle which will prevent heart attacks. And in a country like ours, we do not have enough resources to do angioplasty and bypass of each and every patient. It is for us to decide how to lead a healthy life. It is for us to do exercise. It is for us to prevent heart attacks. It is for us to stay away from smoking, from salt, from sugar, and from sedentary habits. Thank you very much.